And welcome back to Carolina and Company Live. We're live right here, Carolina Orthopaedics, our new location in Murrells Inlet, and we are talking with Dr. Edward Mikol now.
That's right. Now, this is Carolina Coast Surgery Center, home of Carolina Orthopaedics. I got that right that time. All right, Dr. Edward Mikol, how you doing?
Doing well.
Hey, looking good today.
Thank you.
Amanda said she liked that tie.
I do. I love it.
Gift from my wife from our anniversary.
All right, we want to talk a little bit about the history of Carolina Orthopaedics.
Okay.
Yeah, you can talk a little bit about that.
Well, I'm one of the founding partners of Carolina Orthopaedics. We opened up in 2004 with 3 doctors with a desire to serve the people of Horry and Georgetown County. Since then, those humble little beginnings, we've now expanded to, as you say, 7 doctors. We provide the full gamut of orthopedic services. And the facility we're sitting in has been the culmination of 5 years in the making. It's been a lot of work, but we're proud to open up with our clinic upstairs. This would be our flagship office for Carolina Orthopaedics. And down below here is Carolina Coast Surgery Center, where we can do outpatient surgeries. This really is the first facility of its kind in Georgetown County and southern Horry counties, and we're very proud of the hard work that's gone into it.
You got 3 locations. You got Myrtle Beach, Murrells Inlet, and Georgetown. Now, what do you specialize in?
I am a sports medicine arthroscopic fellowship trained doctor, which means I did an extra year of training in sports medicine, and problems that arise generally due to sports. These may involve tendon injuries for the shoulder, could involve ligament injuries, instability, etc. And the arthroscopic part of it means that I do surgery with minimally invasive incisions. So very small incisions, you can do a lot of work in there. And the idea is that you produce very little damage to the tissue surrounding that area as opposed to traditional open surgery.
I'm sure you stay busy then.
We do.
Very nice. So how did this beautiful facility come about?
Well, this really came about as a reaction to what's going on in medicine. You know, we all agree that the U.S. probably has health care second to none, but there is a problem with cost and access to medicine because of the cost, and this is our attempt to adapt to that and hopefully help the community out. In an ambulatory surgery center such as this, we can do uncompromised, high-quality care for a lower cost as opposed to a traditional hospital setting. So hopefully we can bring more people in and get more treatment in a more efficient manner and keep the cost of medicine down. Absolutely.
Well, that helps everybody out. And I can't help but notice, looking around here, there's beautiful pictures of nature and whatnot on the walls. Did you have anything to do with that?
Yeah. Yeah, this is a passion of mine. It predated my entry into medicine, but merges nicely since then, because when I finished my fellowship, I was now able to travel a little bit, and I did take a lot of photos around the world, and I love the outdoors, so if you combine those two things, this is where you end up. However, in this facility, I've tried to limit everything to the beauty we have here in the low country. Most of the photos, with the exception of a few, are taken in the low country, or at least the southeast. And they're here for patients' enjoyment, and even if you're not a patient, you're welcome to come down and have a look.
I've
enjoyed it. I've enjoyed them. I've looked at it when I walked in. That's the first thing I noticed over there.
Thank you.
Well, thank you for being with us. We got a lot more coming up. We're right here. Let me make sure I get this right every time. Carolina Coast Surgery Center, home of Carolina Orthopaedics. You got that?
We're right here.
All right.
Murrells Inlet. More in a moment. Stay right there.